Hi, and welcome to this information seminar on the adverse health effects of fragrances. Many of you are probably already familiar with fragrance, consumer products, and what this means. It's defined its products with an added fragrance or scent, and there are multiple sources of fragrance consumer products in your environment, such as air fresheners, deodorizers, cleaning products, laundry supplies, household items, perfumes, personal care products, and items for babies. And there are more than 150 different VOCs which can be emitted from these commonly used products. VOCs are volatile organic compounds. These are chemicals which contain carbon excluding carbon dioxide and carbon monoxide. They tend to evaporate under normal conditions such as room temperature, so they're in the air. There are common outdoor pollutants, and they're produced by the burning of fossil fuels outside. Inside, the levels are actually much higher, and the major source of VOCs indoors is from fragrance to consumer products. This paper also demonstrated that 64% of asthmatics report adverse health effects from fragrance products. Other health effects: respiratory problems, 43% non-asthma symptoms, migraine headaches. 28% of asthmatics also get migraine headaches provoked. And 28% of the asthmatics reported that they got asthma attacks with exposure. Asthmatics are more likely to experience adverse health effects just by being near someone wearing a fragrance product, or being in a room cleaned with scented products, or from air fresheners or deodorizers, or going outside for a walk and smelling scented laundry products coming from a dryer vent. 99% of asthmatics are exposed to fragrance products at least once per week, and 63% of the reactions are considered disabling. More than a third of asthmatics lost work days or a job in the past year due to fragrance product exposure in the workplace. And more than a third can't use a public restroom if it has an air freshener or a deodorizer. 40% of asthmatics enter a business and then leave as quickly as possible due to air fresheners or some fragrance product. What about people who report sensitivity to chemicals? The prevalence, that is, the number of people in the general population who report chemical sensitivity or have been diagnosed by a doctor with multiple chemical sensitivities, are increasing. The most recent studies in the United States show that 25.9% self-report chemical sensitivity, and almost 13% have been diagnosed by a doctor with multiple chemical sensitivities, or MCS. With respect to sensitivity to fragrances, 92% of people medically diagnosed with MCS are sensitive to fragrance. And of those reporting chemical sensitivity but have not been diagnosed by a doctor, more than 80% complained of sensitivity to fragrances. Scented products worn by other people can be irritating for almost a third of the general population. It's higher in asthmatics, and 2/3 of chemically sensitive people find these things just irritating. Problems from air fresheners and deodorizers is significant as well. 1/3 of asthmatics, almost 2/3 of chemically sensitive people will react to these things. They're found in public washrooms, hanging on the rearview mirror of taxis, etc. What about going for a walk in your neighborhood when people are venting their scented laundry products outside? Asthmatics and chemically sensitive people in particular are quite bothered by these exposures. In the past year, there was a paper published which looked at fragranced baby products. They measured VOCs emitted from 42 common ones and found 228 different VOCs. 43 of these VOCs were classified as potentially hazardous, but only 5% of all the VOCs, or 12% of the potentially hazardous VOCs, were even listed on any product label or any safety data sheet or the website of the producer. Here's what's really important to note. The emissions from green, organic, or naturally fragranced baby products were not significantly different from the regular ones. We also know that pregnant women and the developing fetus are susceptible to pollution. Why do I tell you this? Because it's been demonstrated in the last year that maternal exposure to air pollution during pregnancy is associated with an increased risk of autism spectrum disorder in the unborn child. Mothers with MCS are genetically more likely to be pro-detoxifiers. They are 3 times more likely to have a child with autism, and they're 2.3 times more likely to report a child with attention deficit hyperactivity disorder. This paper looks at the combined statistics from 3 national studies performed in the United States, Australia, and the United Kingdom, and it looked at adults with autism and the effect of fragrances. 84% of them report adverse effects from fragrance products. 84% of adults with autism, respiratory problems, asthma attacks, migraine headaches, and neurological problems. These people are also more likely to experience adverse health effects from being near someone wearing a fragrance product, almost 2/3, or being in a room cleaned with scented products, almost half of them air fresheners and deodorizers. Again, almost 2/3 of them react to these things, and more than half of them react to the scented laundry products coming from a dryer vent. 74% of the reactions are considered disabling, and almost 60% of these people lost workdays or a job in the past year because of exposure to fragrance products in the workplace. What is surprising is that autistic adults are more likely to experience reactions to chemicals and in a worse manner than asthmatics. Look at these statistics. 84% compared to 64% of autistic adults have adverse reactions from fragrances. They have more asthma attacks than were likely to experience effects from someone else wearing a fragrance product or air fresheners and deodorizers in a room or scented laundry products from a dryer vent than asthmatics. And they're more likely to find these reactions disabling. They have lost more workdays or jobs in the past year due to the exposure of fragrances than asthmatics. It's clear that certain chemical odors, even in the smallest amounts, can trigger an attack in susceptible people, those with allergies, asthma, migraine headaches, multiple chemical sensitivity, and even autism spectrum disorder. Most Canadian teaching hospitals have initiated scent-free policies to protect those who are more susceptible to reactions. The policy is endorsed by the Lung Association and by the U.S. Centers for Disease Control and Prevention. If you're interested in initiating a scent-free policy in your workplace, you can get help from the Canadian Centre for Occupational Health and Safety or the Canadian Committee on Indoor Air Quality in Buildings. In an editorial published in the Canadian Medical Association Journal in 2015, it was recommended that artificial scents should have no place in hospitals at all. All hospital environments should be free from artificial scents. It should be a uniform policy. Education and promotion programs within the hospital have a positive effect, and they should be part of hospital accreditation standards. These policies promote safety for patients, hospital staff, and visitors. Avoiding the constant inhalation of artificial scents is just better for everybody. No sense just makes good sense.